Today we're diving into a really complex topic that's often misunderstood: mania. This is so much more than just feeling good. It's a powerful state that can completely upend someone's life. We're going to look at how both modern science and ancient wisdom, from medicine to Ayurveda and yoga, offer different paths toward finding stability. Let's get right into it.
I want you to imagine this for a second. You're behind the wheel of a car, and it just keeps going faster and faster. The engine is screaming, the world is just a blur flying by, and then you reach for the brake pedal, and there's nothing there. You have zero control. This isn't just a scary thought. For a lot of people, it's a terrifyingly accurate way to describe a manic episode.
Because that's really what mania is at its core, a state of profound dysregulation. So in this explainer, we're going to talk about the emergency brakes, the immediate medical help that can stop that out-of-control car in its tracks. But we're also going to explore the long road ahead, the driver's ed, if you will, all the skills and strategies needed to learn how to drive safely and stay stable.
All right, so let's start with the basics. What exactly is mania, and how do different systems of thought, from modern psychiatry to ancient healing traditions, try to make sense of this incredibly intense state?
So from a clinical standpoint, mania is not just a really good mood. It's defined as a psychiatric syndrome. That means it's a persistent, elevated state where your mood, your energy, and your activity levels are just completely thrown out of whack. And the key phrase here is pathological dysregulation. It basically means the brain's control panel has gone haywire. It's a medical state, not just a feeling.
What's really fascinating is how different traditions, separated by thousands of years, kind of arrive at a similar idea. Modern science looks at it through a microscope, right? It sees neurobiological issues, things like dopamine signals going wild and our entire body clocks getting completely disrupted. Meanwhile, Ayurveda, the ancient Indian system of medicine, talks about a concept called unmada. This is described as a major disturbance of the mind-body balance, affecting everything from how you think to how you act. So you've got two very different maps, but they're both pointing to the same place: a system that's profoundly out of balance.
To get a diagnosis of mania, you typically need to have that elevated or irritable mood for at least a week, plus a few of these other key symptoms you see here. And I really want to highlight one in particular: the decreased need for sleep. This isn't just a side effect. It's like throwing gasoline on a fire. Sleep deprivation can actually accelerate the manic episode, making everything worse and spinning the cycle faster and faster.
Okay, so that car is careening down the highway with no brakes. What is the very first thing you do? It's all about finding that emergency brake and ensuring immediate safety.
These are not just little warning signs. These are blaring red alarms. We're talking severe insomnia, like only getting 1 to 3 hours of sleep at night, or sudden high-risk behaviors with money or driving, or especially any signs of psychosis. These are all signals that this has become a medical emergency, and you have to act fast, because mania can escalate with frightening speed. Early intervention is absolutely everything.
And this is where modern medicine steps in to slam on the brakes. The number one goal is safety and getting symptoms under control, fast. The main tools in the toolkit are evidence-based medications, like lithium, which has been a gold standard mood stabilizer for decades, along with other drugs like atypical antipsychotics. These work to quickly rebalance what's going on in the brain. And, because safety is the top priority, this treatment often needs to happen in a hospital setting.
And let's be crystal clear, the stakes here are incredibly high. When mania is left untreated, the impulsivity and impaired judgment can just wreak havoc on a person's life. We're talking financial ruin, destroyed relationships, and even long-term damage to cognitive function. This is exactly why getting that immediate, decisive medical help is so critical.
Okay, the immediate crisis is over. The car has been stopped. But how do you keep it on the road and stop it from spinning out again? This is where we shift from just managing a crisis to building real, long-term stability.
Now this is a total game changer. The research is overwhelming on this point. Psychological support is incredibly powerful. Things like group psychoeducation, which is really just a formal way of saying learning about the condition and how to manage it with other people, has been shown to dramatically cut down the risk of relapse and rehospitalization. This is the driver's ed we were talking about. It empowers people to take back the wheel.
And a huge part of this driver's ed is all about rhythm. Our brains run on an internal 24-hour clock, our circadian rhythm. And this clock loves consistency. So therapies like interpersonal and social rhythm therapy, or IPSRT for short, are designed to do exactly that: stabilize the clock. By keeping regular schedules for sleep, for meals, even for socializing, you're not just creating a routine, you're actively tuning your own brain biology to help keep it stable.
So what about those ancient traditions? We've talked about the modern approaches. How do practices like Ayurveda and yoga, which have been around for millennia, fit into this picture?
Remember that Ayurvedic idea of unmata, that state of mental imbalance? Well, the traditional Ayurvedic way to treat it involves things like purification processes, specific herbal formulas, and, here's the key part, structured daily routines. And this is where you see this amazing handshake between ancient wisdom and modern science. Both of them, coming from completely different worlds, recognize that a predictable, rhythmic lifestyle is a powerful medicine for the mind.
Now, it's really important to be super clear about the science here. While the Ayurvedic focus on routine and lifestyle fits beautifully with what we know about circadian biology, many of its claims about specific herbal remedies haven't been validated by the kind of rigorous, controlled studies that modern medicine relies on. So the concepts are really compelling, but we definitely need more research to back up the pharmacological claims.
So, what about yoga? Where does it fit in? Well, based on the current evidence, it's best to think of it as a valuable complementary practice. It's a supportive tool, not a replacement for medical care. Calmer, more meditative styles of yoga can be fantastic for building resilience to stress. But, and this is a big but, the research for its use in acute mania is still pretty limited. And you have to be careful, because some high-energy stimulating styles of yoga could actually backfire and make symptoms worse. The bottom line is, you've got to talk to your doctor.
So, after all this, what's the big takeaway? The path to wellness isn't just one single road. It's really an integrated system, where you bring together the best of all these different approaches.
Let's bring our car analogy all the way home. First, you absolutely need the emergency brakes from modern medicine to ensure safety in a crisis. Second, you need the driver's ed. That's the therapy and psychoeducation to build the skills you need for the long journey. And third, you need the ongoing road maintenance, those daily lifestyle practices and complementary therapies that keep the road smooth and help you stay on course.
Because in the end, managing mania isn't about reaching some static, perfect destination. It's a constant journey of maintaining a dynamic balance. It's this delicate dance between our biology, our behaviors, and our environment. And that leaves all of us with a really powerful question to think about. What is the right balance? The unique combination of all these things that creates a truly resilient mind for you.